Hey folks, welcome back to the 65 Brief where we explain Medicare in plain English. And today we are talking about Medicare Part A and Medicare Part B, what each one actually covers, and some of the important gaps that you still need to know about. Now, quick note, this content is for educational purposes only and is not connected with or endorsed by CMS, Medicare, or the US government. Now, when you start learning about Medicare, two of the first things you will hear about are Part A and Part B. Together, they make up what I like to call the foundation of original Medicare, but they cover two different sides of your health care. Part A is your hospital insurance, and Part B is your medical insurance. Let's take a closer look at what that actually means. Again, think of original Medicare as two separate pieces that work together. Part A, again, is called hospital insurance. Part B is called medical insurance. Most people who are enrolled in original Medicare have both parts. Part A helps cover certain inpatient and facility-based services, while Part B helps cover many of the services you receive from doctors and other healthcare providers. So first, let's talk about Part A. Again, commonly known as hospital insurance. Part A generally helps cover inpatient hospital care when you are formally admitted to the hospital. So you've got the wristband, you've got the gown, you're in the hospital. It may also help cover qualifying care in a skilled nursing facility, hospice care, and certain home health services. The important word here is qualifying. For example, skilled nursing facility coverage is generally intended for short-term skilled care. It is not the same as long-term custodial care or permanently living in a nursing home. Part B is commonly known as medical insurance. This is the part that generally helps cover services from doctors and other healthcare providers. That can include primary care visits, specialist visits, outpatient procedures, your lab work, your diagnostic testing, preventative services, checkups, all that stuff. Part B may also help cover ambulance services, mental health care, and durable medical equipment such as walkers, wheelchairs, and oxygen. It can also help cover some medications given to you at a doctor's office or outpatient visit, but it does not replace regular Part D prescription drug coverage. Here's a simple way to remember the difference. Part A is generally associated with being admitted to the hospital. Part B is generally associated with doctors and outpatient care. The word admitted matters because you can receive care inside a hospital without officially being admitted as inpatient. You could be receiving outpatient or observation services instead, and some of that care may be covered through Part B. So the location does not always determine which part of Medicare applies. Your official patient status and service you receive, those are the things that both matter. Now, even with both Part A and Part B, original Medicare does not cover everything. It generally does not cover most routine dental, vision, and hearing care or long term custodial care. Most prescriptions that you pick up from a pharmacy are also not covered by Part A and Part B. There can be limited exceptions, so it's important not to assume that a service is either always covered or never covered. It's you definitely want to look into it. Original Medicare can also leave you responsible for deductibles, coinsurance, and other out-of-pocket costs. And this is why many Medicare beneficiaries consider additional coverage. One option is Medicare Advantage, also known as Part C. Medicare Advantage is a different way to receive your Part A and Part B benefits through a private insurance company approved by Medicare. Another option is to stay with original Medicare and then add a Medicare supplement plan, also known as Medigap, to help with certain deductibles, co-payments, and coinsurance. And then they also may enroll in a separate Part D drug plan for prescription drug coverage. These options work differently. So it is important to understand, the costs, the benefits, provider networks, and the rules for the plans before making a decision. So let's put the two parts side by side. Part A is hospital insurance. It generally helps cover inpatient hospital care, qualifying skilled nursing facility care, hospice care, and certain home health services. Part B is medical insurance. It generally helps cover doctor services, outpatient care, preventative services, and durable medical equipment. Again, the simple way to remember it is Part A is generally associated with being admitted into the hospital. Part B is generally associated with doctors and outpatient care. Together, they form the foundation of original Medicare, but they do not cover every service or eliminate every out of pocket expense. The biggest takeaway is that Medicare Part A and Medicare Part B work together, but they cover different types of care. Understanding those two parts makes it much easier to evaluate the additional coverage options that are available to you before making that final decision. This has been another episode of the 65 Brief. Subscribe for clear, plain English Medicare education without the confusion. Thanks, and we'll see you next week.